Thank you to the witnesses for your testimony today. The Medicaid program embodies a deep and long-standing partnership between the federal government and the states. Every individual has a right to health care, so thank you for working to ensure the most vulnerable in our communities can also benefit from that right. This is the third Medicaid fraud hearing the Republican majority has held this year, despite their presenting zero, I repeat, zero evidence of widespread fraud. At the same time, they have let the Trump administration fire inspectors general and others actually doing the work to address the narrow cases where fraud does exist. President Trump has been using the guise of investigating fraud as a smokescreen to punish the states he does not politically agree with. This administration is putting the health coverage of millions at risk in states like California, all to score political points. While the majority is politicizing this vital healthcare program, hardworking public servants like Director Sadwith aren't focused on cheap headlines. He is working to ensure Californians have healthcare coverage and that public dollars are being spent responsibly as intended. So Director Sadwith, you mentioned in your testimony that Medi-Cal goes above federal standards to screen providers before they gain access to the program. Can you please explain how California is exceeding federal requirements to prevent bad actors from ever gaining access to Medi-Cal?
Thank you, Congressman. I'd be happy to. So when providers initially screen, we collect and review information that CMS doesn't require. These include state-specific standards around established place of business. So for every single provider site that enrolls, we look at leases, business licenses, general liability insurance, and so forth. We also require our managed care plans to conduct monthly screening against state and federal exclusionary lists and databases, just to further ensure there are no bad actors in our program. We also exceed requirements regarding how frequently we revalidate providers, and revalidating is in effect rescreening against all databases and checking to make sure that they're legitimate. Anytime a provider in California adds a new location, changes their address, or changes ownership, that triggers a full revalidation, which often happens more frequently than every 5 years as federally required.
So thank you for that explanation. Your testimony today is vital for us to parse between false claims about Medicaid and what is actually happening on the ground in my home state of California. The administration has been laser focused on the IHSS program in Medi-Cal, which allows elderly and disabled individuals with long-term care needs to remain in the comfort of their homes. Based almost solely on growth in the program, the Trump administration recently deferred over $1 billion for that IHSS program. So Director Sadwith, what are the reasons for IHSS program's growth and cost increases that you have explained to CMS? And what are the impacts of this $1 billion deferral on Medi-Cal? And how are you working to ensure that beneficiaries still have access to those services?
Thank you, Congressman. The intentional investment in our in-home supportive services program reflects a long-standing partnership with the federal government, including Congress and CMS, who have consistently, over the past quarter century, promoted and expanded the use of home and community-based services. That is because these are the services that are best for individuals who depend on them. It's also better for taxpayers. We know these are cost-effective. CMS asked about our growth. We explained that several years ago, the California State Auditor, an independent fiscal watchdog, reviewed our IHSS program. And while they found no program integrity concerns, the audit did have one recommendation. They recommended we increase reimbursement rates so we can expand the IHSS workforce to meet the needs of California's aging and growing population. So we did that. We increased payment, we increased caseload so more people can get these services, and as a result, the program grew. This is a concerning deferral, and we are working steadfastly with CMS to respond to all of their questions, provide all the information they need so they can release the deferral and recipients can get the care they need.
So let me just conclude that Medicaid is a lifeline for millions of Americans. Rather than using California as a political punching bag, we need to be focusing on our efforts to strengthen this important federal-state partnership. And with that, Mr. Chair, I yield back.